So I want to bring in Anjalee Khemlani to help further along this discussion because next week is crucial for Johnson and Johnson when they do start reporting the results of 45,000 people who are part of the tests. And Joe, I don't know if you got to see a part of the interview where he actually said that includes people who've been tested in South Africa and Brazil. Did you pick up on that, Anjalee?
I did not hear the full part, but I do know that they have made comments about that in general, company officials talking about the idea that they are keeping track of these variants, and that's what every company seems to be doing right now. So let's talk about J&J first. Of course, we know it's a one-dose vaccine. They're expecting the results early next week, and after that is when we go into territory that we're familiar with from our experience with Pfizer and Moderna, and that is getting into the EUA, which could come late February, which would lead to a rollout of the vaccines in March. And that's important because we also know that in that interim is when we're still relying on Pfizer and Moderna to continue vaccinating individuals here in the US. Now, we know that they are also looking at a two-dose trial as well for later this year. That's when we'll hear more about that. Meanwhile, a lot of other news coming out for vaccines. Pfizer saying that they've completed the enrollment for the 12 to 15-year-old group, and that is a group that they started looking at in July of last year. We know that, of course, vaccination for young adults and kids is still unknown, and we need to be looking at that. So Pfizer, with that announcement today, they've enrolled more than 46,000 individuals and are ready to go through with that. Meanwhile, also in the treatment space, Regeneron out with information on their cocktail antibody therapy and about the positive results there. Of course, we don't know the full data, and this is just based off of the press release that says that it reduced symptomatic cases by 100% and all cases by 50. And this is really interesting because we've seen it as a potential for a vaccine-like treatment for individuals who are high risk. We also know that others like Eli Lilly are also already out there, but they require more labor-intensive administration. So this could be something that a lot of people are looking for. Meanwhile, all eyes on the strains. We've got confirmation of that strain out of Brazil, P.1, as of yesterday from the Minnesota Health Department. And that has spurred a lot of concern about travel. We know that the U.S. is now really cracking down on travel with a negative test required 72 hours before arrival, and certain areas and parts of the world like the UK, Europe, Brazil, and South Africa having banned. And this is not new. We saw this sometime last year, but we've also seen other countries take similar stances. So this is not new again, but it is a sort of a reaffirmation that the Biden administration is really cracking down on all of these things that need to be done in order to help curb the spread. Adam.
Hey, Anja, what do we know about the Brazilian variant? I believe it's called the P1 variant. It was found, like you were just saying, in Minnesota. But what can you tell us just about the transmissibility of this variant and what it could potentially mean just in terms of the U.S.'s efforts to get the pandemic under control? How does it complicate that?
Well, just like all the others, it is more virulent, but this one has more similarities to the South Africa variant, and that is the reason why it is of concern. We know that we learned so much about South Africa's strain B1351 yesterday because Moderna had done the study with its vaccine, showing that it is still effective against that South Africa strain, but just a little bit less effective than it would be against the UK and the other strains that are around. So it seems like that is a reason for concern, is that it shares that similar mutation that would make it a little bit more resilient. Now, while this doesn't affect vaccines that are already on the market, some experts are pointing to others that have lower efficacy rates. Remember, Moderna and Pfizer have that 94-95% efficacy. And so with others that are lower, it could reduce the effectiveness of those vaccines. So that's where the concern currently lies.